A very good afternoon to everyone. My name is Fahad Shahid, and we are live from Prime Health and our YouTube channel Prime. Uh, as we know that summers are about to leave us, and we are going to have some new activities coming up as the pandemic is moving on. And of course, it's the time that the schools are going to be open for the kids. Definitely, there will be some schools which who will still have the work study from home, but there will be some schools who will definitely open, who will be open, which will be open for the kids. So we are going to talk about a lot of questions that we have here today. A lot of parents are actually looking forward to ask and they want to know before they are sending before they'll be sending their kids to the school. So that's the reason we have taken the topic today, back to school, and we have a very important personality here with us. I should say I've got here Dr. Vinay with me, who's the specialist pediatrician at Prime Medical Center Al Nahda branch. Doctor, thank you so very much for joining us today here.
Thank you so much.
Initially, Doctor will be speaking about back to school, whether if you are really confused to send your kid to the school, or are you looking forward to have some answers that before you take a step or make a decision on this. So Dr. Vinay is here with us, who will be answering all your questions for the next 35 minutes. And probably if you have any questions, please look into the comment section and write it down there, and Dr. Vinay will be answering your questions live here with us. We've also got some questions that came pre-session, and we're going to ask those questions also to Dr. Vinay. So Dr. Vinay, without delaying further, as you know that it is back to school time almost there, and a lot of parents are now into this confusion or into this process of deciding whether they should be sending their school kids to the school or no. We really need to look into that. So what would you have to say on this, please? Thank you.
Good afternoon, everyone. Salam, namaste, everyone. I'm happy to be presenting this very important and relevant topic on back to school. I thank Prime Healthcare Group to choose me as a part of presenter. And I'm Dr. Vinay Vyas, a specialist pediatrician in Prime Medical Center, Al Nahda. I've been practicing since 16 years all over, and I'll be very happy to answer your questions regarding back to school. So, as we know, this has been a very difficult year. It has been challenging for all the parents and teachers and students all over the world, including our place, UAE. And it has been quite challenging to send our kids to school. So I would be congratulating them. Since March 2020, it has been very difficult for them. Congratulating on their resilience and their commitment to continue the school as distance learning or as face-to-face, or it may be a hybrid. So I salute them on their commitment and resilience. Here, what has happened that since the pandemic has started, most of the children were supposed to stay at home, and it was suddenly put on them, and nobody was ready for it, but still they could manage to go through the curriculum, the assignments, the assessment, all. So big salute to them. Now coming to the topic of back to school, still it has been a bit confusing whether to send your child to school or whether to opt for learning. Is it distance or hybrid learning? So most of the parents which come to our clinic, I have asked them they are not sure whether they will send. It depends on the school also, and they mentioned that we are not still confident. 40% of them, they are looking forward to send their wards to school. This has been a really challenging part to send your child to school, because there are risk of acquiring infection. Parents are worried whether, but they are liking to send, but still worried whether we should send. And what to do to make them more confident is getting prepared. So other than the parents depositing their school fees, there are other preparation also to be done. The usual ones are those to buy school books or to buy stationery. But here we are talking about COVID-19. So what they should do before sending their wards to school. So it begins almost 1 week prior to the return of school, and that is to start with the basic sleep pattern, the basic activity, the basic routine which they should come into, because they have been lazy since there has been a long 1.5 month of summer break. So they should make the wards ready for the school, in the sense of making a routine and sleeping and eating and also the activities. Again, to start with, they should communicate more with their children. Let them have more words with them. If they are older ones, adolescent, they are younger ones, whoever, they should talk more to their parents, and parents should also reply to their concerns. To start with, they should monitor the health, and for monitoring and regular checkup, they should visit their primary pediatrician for a complete health checkup. At least go to their preferred pediatrician and let them have a look at their head hygiene, the hearing, the eye screening, the dental checkup. They should also be aware of if there is any significant tonsils enlargement or adenoids. Growth and development is again, yes, very important aspect of getting their children checked up. So most of the time we have seen that there have been challenges because of staying at home. Most of the time they have grown their weight, and they are often become lazy in most of the speech delay is also one big feature which we saw during their visit to us. So the parents should be aware that how much, what should be their development age in linguistic point of view. Further, vaccination are also should be discussed. There are so many vaccines. Flu vaccines are going to come in September end, and we are very much looking forward to put flu shots to all the kids. Since the symptoms and signs are overlapping with COVID-19, we don't want to take chances, and we don't want them to get confused in having a flu infection or is it a COVID infection. So that is also very important. Apart from that, there are so many optional vaccines which are there, like meningococcal, typhoid, and hepatitis A. Since most of the children they are coming from the subcontinent, they may acquire these infection, and they should be thoroughly discussed with your pediatrician. The mandatory vaccines are definitely to be selected on. Now, how do you prepare your child for school? It starts from the bus. Make sure that you speak to the transport service agency that bus is well ventilated. It has got only 50% of occupancy, and it's kept clean all the time. And make sure that you teach your children that entry and exit should be properly done. Proper etiquettes have to be taken care. And while exiting, avoid touching and avoid making a social distancing even in the bus as well. Now, going to school also, there are three important features which you need to know. Is one is social distancing. Nowadays, the social distancing limit has been reduced to 1 meter. So let your children know that it is to be strictly followed. Mask has to be kept all the time for school-going children. Early learning center children are exempted to wear mask, but school-going children always should put on mask, and you should teach them how to put on mask. It should be got from the threads and not to touch the mask itself, and should be disposed properly, and you should always keep an extra mask with them. The third point, which is also very important, is hand sanitization. The hand sanitizer is best done by washing your hands with soap and water, and properly cleaning it thereafter, and wiping it with a proper tissue. Always, you can use hand sanitizer in between also, but then preferably it should be the soap and water. Now, during the stay of in the school, there are like chances of acquiring infections. So avoid gathering, avoid hugging, and getting close to your friends, uh, and also avoid eating or sharing food with somebody else. It should be in designated areas only. And when they come back from school, the bag has to be placed in a designated area, and then they should directly go to wash themselves. Bath is one thing which is important after coming back from school. This all is very important in face-to-face learning, because they go, and even in hybrid learning, because they go and they may acquire infection. So to prevent it and protect them, these are very important points. Now comes to distance learning. That is also very challenging, because a small child won't sit for long in front for distance learning. It's very difficult for parent to make them sit for long. So that has been yet another problem. So I advise parents to monitor what children are doing, what they are studying, and they are not sneaking into any YouTube videos or playing games in between. But then make sure that you don't impose anything on them. There are like challenges, and there are problems pertaining to like eyesight, vision, complaining of blurry vision. You should directly get them checked to an ophthalmologist. Rest, you should see about their confidence level. Mostly they have gone down. They are shying away with the activities. Social interaction is very much gone down. There are other mental health illness also when they are mostly distance learning, because they feel themselves to be more of anxious and depressed, and most of the children, they have gone through a big psychological impact. So please refer them to your primary pediatrician, and then you can get it solved as soon as possible. I would like to conclude that don't hesitate to come to the clinic. We at Prime, we are very much happy to see you, and we want to allay your concern as much as possible. Hopefully, you can meet them. Most of our Prime pediatricians have got excellent knowledge, and they can pass on to you. Thank you so much, and I would like to accept all the questions, and we'll discuss it
Right.
further.
Thank you so very much, Doctor. That was very detailed information that you've given. Doctor, a few of the questions, I should say, scenarios that would really come up with. I would like to ask a few questions if you can just answer that. Is it safe to send my 5 years old son to school?
Yeah, most definitely. Yeah, it's safe. You should speak to the school authorities, relevant authorities, like if you are in Dubai, KHDA, in Sharjah, SPA, and Abu Dhabi, it can be added. You speak to, you give, send a mail, and you can allay your all the concerns, fear, and they are definitely helping you out. And even school authorities like principal and relevant teachers, they are very much supportive to the children who definitely seek coming to school. 5 years child, I would definitely recommend them to go to school, because at home it's very almost impossible for them to sit in one place for long. So they are the basic people, the student who should go to school.
Thank you, Doctor. Doctor, if a child has an asthma, should he or she should be going to the school?
Yes, asthma, if it is controlled and it is asymptomatic, definitely they should go to school. This COVID-19 has been a respiratory illness, but then still it has not have impacted much of the children. And fortunately, they were not inflicted with severe illnesses. Very rare of them had severe respiratory illness, and that also would be less than 0.1%. So asthma, if it is controlled, but properly monitored, they should go. And one thing is that they should also inform the school doctor, the school health professional, to know that my child has got asthma, so please take care of them.
Right, thank you. Another question, Doctor. My boy is 7 years old, doesn't sit in one place. How can I make his distance learning?
Yeah, that has been again a very difficult aspect of distance learning. There are many ways of getting them into distance learning. One very important and easier method is if you can connect your device to a television, and you get a larger space for them to see and to definitely react. So definitely, if they are roaming around, they can focus on TV and they can have and can be given some reward if they are sitting for a longer time. Okay, you can talk to their teacher and make sure that she also understand or he also understand them, and that can be taken ahead.
Perfect. Doctor, talking about the vitamins, which vitamins are good for the children?
Usual vitamins are there in a balanced and healthy diet. So all our diet has got most of the vitamins. It is an individual perspective. If a child is not eating certain food, fruits and vegetables, they are definitely should be supplement with the vitamins which are relevant and which he or she may be deficient in. So it depends on the individual food intake, whether they are eating or not. Apart from that, vitamin D is something which has been quite difficult, and kids are really deficient in it. Get the vitamin D checked with the pediatrician and try to expose children to sunlight as much as possible, but be safe in not getting them burned. So most of the vitamins are there in the food except vitamin D. Apart from vitamin D, they are like zinc is also important. Iron being very important. So get them checked from pediatrician if they are having yellow face or they are deficient in eating vegetables and stuff which are definitely good in iron. So get them checked with the pediatrician, and if relevant deficiency is there, go ahead.
All right, doctor. Another question. My 8-year-old was on steroid before. Can I send her to school?
Yes, this is also a very relevant and interesting question. 8-year-old having taking steroid prior is no more a risk factor, but then it depends how much months before or days before it has taken. If it is not a recent steroid intake, then definitely they can go ahead with the school. But with again, it is an individual approach, and so you should definitely contact your pediatrician and get more information with relevant to it and what disease they are having, so that they have to take steroids.
Absolutely, doctor. Thank you, doctor. School bus is another important thing. Actually, I should say, is school bus safe to travel?
School bus, yes, it is safe to travel, but then you have to, as I mentioned, that you have to check all the prevention and the care which they have taken in proceeding or starting school bus. So, as I said, that there shouldn't be any occupancy more than 50%. They should sterilize their bus frequently and regularly. They should keep proper social distancing and monitoring when you monitoring the children before entering and coming out from the bus. So if you feel confident on their services, you are definitely it's safe to send your child in bus.
All right, great. Doctor, the question is, my child blinks a lot during online studies. How to deal with it?
Yeah, that's also very frequent complaints by the parents. This is one thing which has happened mostly in distance learning children. They have to focus at least 6 to 8 hours per day in their studies. Earlier they were maybe 2 to 3 hours, but now then suddenly it jumped into 6 to 8 hours, and that also the studies, and then they have got increased screen time by watching tubes and YouTube and these games. So this kind of dry eyes, excessive blinking is very frequent. I would suggest strongly to check with the ophthalmologist, the eye doctor, who may help if there is any refractory error or some dry eye syndrome. So I would strongly recommend the ophthalmologist in that case. There are certain ways which you can reduce the strain by, as I said, that you can increase the size of the screen, keep the device connected to the television, and make them sit a bit far. So that definitely helps. There are some anti-glare devices also, some blue screen also it is recommended, but I would surely suggest them to go and contact ophthalmologist, the eye doctor.
Great, thank you very much, doctor. Doctor, now vaccination is something that we are hoping, we have a hope on that. Is COVID-19 vaccination safe for children?
Yeah, thankfully, UAE has started on vaccination of COVID-19 to kids 3 to 11 years of age. It is said to be that this is the final nail in the coffin of COVID-19 pandemic. So I hope it is such. But then I definitely recommend this vaccine, and at least it would prevent the rare severe illnesses which are there, like multi-inflammatory syndrome disease. So definitely recommend them to the children who can safely take that. Yeah.
Great, thank you. Doctor, I've got a question here from Mr. Prabhat. And the question says, Doctor, wearing face masks for a long time in school, is this safe for kids?
Yes, surely. It's much safer, I believe, than acquiring infection. There are some face masks which maybe kids may be sensitive to, but the medical masks which are used fitting their proper size is very important. And it is very important to explain them how to put and how to remove it, and also how to dispose it. uh, Putting face masks is very, very important, as we know that COVID-19 is mostly spread by droplets, and particularly the new variants are mostly spread in the air by through droplets. So I strongly recommend them to wear mask all the time. If any issues are there are some issues which I have seen personally, is some allergies are there which can be easily dealt. You can you can contact your pediatrician and make sure that you these minor ailments can be easily treated.
Perfect, that's great. Thank you so very much, Doctor. I'll be asking you the next question. Uh, Doctor, what do you have to say about celiac disease and school?
Celiac disease and school, yes, yeah, but then it's celiac disease is something which it's related to the gluten sensitivity in your guts, like your intestine. So those are certain food products which children have to avoid intaking, otherwise they may have problems like diarrhea and those things. It's not very relevant to the COVID-19 infection, because we haven't seen any spurt or increase in cases of celiac disease flaring up during COVID-19. So not very much relevant to COVID-19. Celiac disease children can definitely attend school. But then important thing is not sharing food with anybody, because that is something which they don't know what they are eating. So if they are not aware of what they are eating, and if it has got gluten in it, they may land up into problem.
Okay, great. Doctor, question is, if my child has been immunized for flu and the kids around her haven't, will her immunity be less effective?
Not at all. If your child has been vaccinated with flu, definitely the individual immunity is there. It won't be less effective at all. In fact, we recommend in this coming fall that every child should take flu, because the symptoms manifestation are pretty much like COVID. But thankfully, COVID-19 has been milder than flu. So definitely we can avoid flu by taking flu shots.
Perfect, thank you. I've got a question here from Ms. Riya. Hi, Dr. Vinay. Is it safe to send kids to school or to opt for online learning? My daughter is 4.5 years old.
It's safe to send your daughter to school. In fact, as I mentioned, that children who are below 8 years, they are facing a lot of challenges in having distance learning. So it's safe to send, provided you know all the protection and prevention of your child, and your school is very much serious about it. So it's safe to send them if you are satisfied with the management, school management has done on health and safety issues.
Perfect, thank you. Doctor, what would you suggest as a healthy lunchbox for a child who's probably 10 years old?
Yeah, that's also a common question which we used to see in clinics. I always say that anything healthy is not a fixed diet. Since we come from different areas, we have got different eating habits. Some eat rice, some eat roti. So it's not something which is common. Whatever relevant stuff is divided into like fats and proteins and carbs and vitamins and iron and minerals should be there in your food. So parents should make sure that they are including fruits and vegetables in their meal stuff. Calorie counts and calories are mostly been it's completed as such. But fruits and vegetables are the most confounding factor which I've seen kids avoid. So please focus on these two items, and healthy food stuff is like avoiding junk food. Everybody knows is something which is very important. Rest, it depends on the culture which you follow and the food what you eat.
Thank you, Doctor. Doctor, what do you anticipate the COVID-19 vaccine will be available for children younger than 12?
Yes, it is available
It's already
already.
available, right?
So
Yeah.
in UAE, it's available, and we are fortunate enough to have them at present. So please get it done. Most of the time, I ask parents that you haven't asked the brand before of your vaccine. Why you are asking the brands now? So don't go on brands. Anything which is been approved is definitely going to protect your child, and that is very important.
Right. Doctor, important question. If a parent tests positive or has COVID-19 symptoms, should their kid stay off school for 10 days?
Yeah, that is also very specific question. Uh, this depends on, first of all, when a parent has become positive, they should inform school authority, and school authority should further inform their relevant education authority. The like if you are in Dubai, then DHA would definitely give you a call and will guide you for your son or your daughter whether she or he should go to school. So this would be as per the protocols of the relevant authority which your child goes.
Perfect. Doctor, if there is an outbreak in a class or school, will everyone be tested? Will everyone be sent home? What are the protocols that schools are following? You have any idea of that?
Yeah, school. I've seen that school they are making certain groups of children come on days like hybrid studies. They do invite around 15 to 20 children, and those are kept in certain bubble. So if any child gets positive, they definitely test the rest of the children, but not whole school. So mind it, those who have come in contact with a COVID positive child would be tested and would be taken care of, but not whole school. So it's not a matter of panic to be in, but definitely be cautious. Communication is very important. Communication between a teacher and a parent is very important in this scenario, because they will update immediately and inform that what to do next. So it depends on school's protocols, and definitely you should be in touch with the teacher and school authority.
Perfect. Thank you. I've got a question here from Mr. Saeed Bukhari. Doctor, can children take flu vaccine and COVID vaccine also together? He means to say.
Yes, they can take both because both are vaccines dealing with separate viruses. So if you're planning to go ahead with the COVID-19 vaccine, yes, please do it. And if you are planning for flu shot, yes, yeah, please do it as soon as they come.
Okay, great. Thank you, Doctor. Ms. Ria has asked another question saying, for COVID vaccination, what should be kids' age? If you can just quickly mention that, Doctor.
COVID vaccination, the age has come as 3 years and above. So there is they have started giving vaccine from 3 years to 11 years. 12 years and above were already been taking the vaccine. The brands are different, as I said, but then don't go on brands. We have to protect our children as soon as possible.
Thank you. Doctor, talking about the new Delta variant, probably a lot of people are saying, and we have this information that Delta variant is more contagious. What are the symptoms, and is this dangerous and harmful, or coming to the kids itself also?
It's dangerous and harmful. There are no statistics about it, but then definitely it is highly contagious. It's twice as highly contagious as other viruses are. So contagiousness is more in Delta variant. Being severe and not no, we don't have much of data suggesting that they are more severe or they cause more problems, but definitely they are contagious. And yeah.
Okay, right, right. So that is to be taken care of actually. Okay, as we are moving towards the end of the session, I'll be asking you one more question, and then we should proceed for their closing. Uh, Doctor, what should my child's school be doing to protect kids from germs? What are the possibilities of prevention that school is taking or they should be taking?
Yeah, schools are taking their own protocols, and they are very much serious about protecting every child's health. So most of the schools have to report any of the new infection to the education authority like KSD in Dubai, and they have to make sure that they are dealing it with very seriousness. To begin with, protecting your child from germs is they monitor as soon as you enter the school. They will monitor the temperature. They will avoid the gathering, which they should, and they should keep proper social distancing. Now it has come to 1 meter and wearing masks all the time, and particularly it is important while they are when there is a lunchtime and when kids are eating, so they should put them into a designated place which with a proper social distancing, because masks are not there at the time of eating. They should keep hand soaps, and they should make kids access to the water, and make sure that they are sanitizing their hands. Also, they should sterilize the place regularly and not allow the maintenance people and other people to get into the classroom when classes are going on. So they are doing a lot of stuff, and we really appreciate them to be so much careful in this whole process. It has been a very fabulous job done by them.
Right. Thank you so very much, Dr. Vinay. Dr. Vinay, we've answered all the questions out there from the parents who've asked, and I believe a detailed information is given to everyone out there who are watching at this time and who will be watching us later. Doctor, to summarize the whole webinar of today, the whole session of today, that is back to school, what you'll be saying in a couple of lines to tell to the parents whether they should be sending their kids to the school or how it should be, just to summarize it in a couple of lines.
Yeah, surely. I would say that it's always an individual preference to send their wards to school or keep them in distance learning. But then you should definitely reach to the doctor if you face any problem in any of the case. For the face-to-face, as you are keeping your child in risk of infection, definitely when the child has got any signs and symptoms, definitely reach to the doctor, your primary pediatrician. In distance learning also, if you find any of the behavioral problem, mental illness, speech delay, eye problem, or hearing problem also, definitely reach to the doctor and don't hesitate coming to the hospital or clinic, because it is very safe now.
Perfect. That's great, Doctor. Thank you so very much for the information that you've given, Doctor. As you said, it's much safer than before. Thank you to all the people who are watching, and we've got a few appreciations for you, Doctor, from the people who are watching you live at this time. A lot of thanks from all the viewers here with us. If you have any concerns, if you are still worried to send your child to the school, or if you have any you feeling that you've got the kid has COVID symptom, or you're worried about any of the health conditions, you're more than welcome to visit Dr. Vinay. He is currently practicing in Prime Medical Center, Al Nahda branch. And he will be definitely there to help you. You can always book an appointment through the Prime Health Me app that you can see at the bottom of the screen scrolling, or you can always book an appointment by calling the number 047070 and we will guide you as per the schedule of the doctor. If you have any feedbacks or concerns, please do give us feedbacks or Google reviews and on Facebook reviews at Prime Health page, and how we can definitely bring more and better sessions for you. If you want to write us, you can write us to myprime@primehealth.ae. We will always be there to support, as Prime is always about personalized care personally. This is the reason we are always trying to bring awareness to all the people, all the parents, all the members out there. So we'll be coming back to you with another live session very soon. A big thank you to Dr. Vinay one more time. And till then, take care. Bye bye.
Bye bye.